It's now recording.
All right, so today we'll go over the revisions we've made to the newborn screening dry blood spot card for South Dakota. And thanks again for everyone for joining us. Today you have a couple presenters. So my name is Ashley Comer and I work at the newborn screening lab in Iowa, and I'm the newborn screening quality improvement coordinator at the State Hygienic Lab. And then also joining me is Emily Phillips, and she's a short-term follow-up nurse at the University of Iowa Stead Family Children's Hospital. So for South Dakota samples, they are tested here in Iowa as the contract lab at the State Hygienic Lab. And abnormal results are initially called to the University of Iowa Stead Family Children's Hospital for some results. And then they coordinate with Sarah Grovenfeld there in South Dakota to continue the follow-up process for any newborn screenings. And we have also on the phone Sarah Grovenfeld, who does the follow-up for South Dakota, and also Lucy Fossen with the South Dakota Department of Health and the newborn screening program. So they'll be on the phone too to answer any questions at the end as well. Here's an overview of the redesigned card. So for the overall appearance, it's very similar to our current card. The color and everything has remained the same in the size. There's been some additional fields added, and then we've also rearranged where the fields are located on the card for some of them. In addition to the redesigned card, we've also created educational material to complete the newborn screening, excuse me, dry blood spot collection card. I'm going to keep coughing. Hold on just a second. Sorry about that. So located on the website for the South Dakota newborn screening is specimen collection card instructions. And this is an educational fact sheet that will we'll send out with the new forms. You can use it to orientate new staff or just a refresher for current staff. If you click on this link, it will bring you to the website here. And there's, these have been sent out to you guys already. Some of you may have received them already, as well as an announcement. And this is what it looks like, just a preview. So it goes through just what we're going to go through today, each field by field of what's required and what's expected of each field. So that is a good resource to also go back and look at if you have any questions. What we wanted to emphasize is that this form is not just a form, it's actually a baby. So filling out it's extremely important that every data field on the specimen collection card is filled out completely, accurately, and legibly before collecting the sample. All the requested information is vital to ensure proper testing and timely follow-up of repeat or confirmatory testing. The collection card information is essential to the infant match between the newborn screening lab and the South Dakota Department of Health electronic vital records and screening system. Since this is a medical collection device, I wanted to point out that we have to reject any sample collected on an expired form. So we ask that you, before collecting a sample, also check the expiration date on the card, which is located on the left side of the card, and I'll point that out on another slide. And now, actually, on the new card, it's also printed on the back of the filter paper itself, which is nice. So right before you're collecting, you'll be able to see what the expiration date is. Any delay may put the child's health at risk, so any missing information could possibly be a delay that we'd like to avoid. The specimen submitter is legally responsible for the accuracy and completeness of the information on the newborn screening card. We also want to remind you to remove the second ply for your records. And then please write firmly in blue or black ink to ensure that all the information is transferred between all the carbon copies. One of the new features of the form, in the lower right corner are two boxes. Currently, there's one box that says place the HL7 label within this box. At this time, you can ignore this box. There are no South Dakota facilities that use HL7 or Health Level 7 at this time. It's a way to electronically order and send results back between the newborn screening lab and your facility. And like I said, at this time, you can ignore it. Just please don't put anything in this box. And then the next box to it is actually where in the newborn screening lab we accession the sample. So again, if you could leave that blank as well for our use here at the newborn screening lab. At the top of the form is sample level information. So there's, starting from the left, there's initial screen or repeat screen. Please check one box, either the initial or repeat. The repeat screen should be marked for any subsequent specimen regardless of the reason. So even if the first sample was submitted and it was rejected for quality reasons, the second one collected is still considered a repeat by the program. The change we've made here also is the collection information has changed the location, so it's now at the top of the form. And we've also changed the format of the date captured here. So it's now an 8-digit format with the year first, followed by the month, followed by the day. Next is the collection time field, and again, it's still in a 24-hour clock. And then the last field is collector information. So this field is intended for facility use primarily. Each facility can decide how they want to record collector information. So anything that would uniquely identify a collector can be written here, such as initials, their last name, employee ID number, etc. The next section on the form is infant information. So starting in the top right is a field for infant medical record number. This is a number that should be used to reference in your system. So if you're getting results, it should be something meaningful for your facility. If it's a medical record number, great. If you guys would prefer to use a chart number, anything that can be linked back to the patient's record at your facility. Next is the the infant's last name. It's extremely important to list the last name for this infant, and we ask if you know the last name that they will go by at discharge to please record that and not just mother's last name. This helps locate a baby that's been identified as at risk for a disorder and identifying them, the child post-discharge when following up on any abnormal results. Providing an incorrect name potentially could cause delay in treatment and negatively impact the infant's health. Next is the first name. If it's known at the time of collection, we do ask that you record the infant's first name as well. This helps, again, when calling the doctor's office after the baby's been discharged to help locate this baby. If the guardians haven't yet chosen a first name at 24 hours, I know that this isn't completely uncommon to not have a first name, go ahead and leave that field blank. Then the infant's date of birth, again, it's the same as the collection in terms of the format. All the dates have been switched to 8-digit format with year, month, and day. Infant's birth time, again, is in a 24-hour clock. Infant's gender is the same as on our current form, so please mark either male, M for male, or F for female. If it's not known or there's ambiguous genitalia, it's okay also to write in here unknown, and that can provide us information as well. Okay. Some new fields on the form are the infant's street address. So we're now asking for the infant's residence, and that is important to be able to locate the baby should we need to go that route during follow-up. So please record where the infant will reside in order to locate the baby if necessary. So please give us the complete street address with the city, state, and zip code. The other thing that we've changed is the way we are asking for multiple birth information. Under the current form, it asks for 1, 2, etc., and we've changed that now to be A, B. So if a infant is one of a set of multiple births, twins, triplets, etc., record the birth order of the infant with A being, of course, first, B second, etc. If it's a single birth, you can leave blank. You can put a line through it or cross it out if you feel the need to do that as well. This field is not in reference to the birth order of all of the pregnancies of the mother, but the birth order of just this one pregnancy. And then gestational age at birth. We request the gestation age at time of birth for initial and repeat screens. You can record this in completed weeks only. No need to round up. Accurate gestational age is critical for analyzing the results of the newborn screening tests. If by chance the gestational age is unknown, this again is okay to write in here as unknown. Going down, going down or over to the right, it's not highlighted here, that's what threw me off a little bit, is the feeding method on the right-hand side. Check all the types of feeding that apply within the last 24 hours. For example, if the infant has received both TPN and breast milk in the last 24 hours, check both boxes. As you can see, the options have changed a little bit here as well. There's no longer an MPO on here or other. Breast milk would include any more milk that was sourced from the biologic mother or donor milk. Formula would include all special formulas and additives, so human milk fortifier, benoprotein, etc. TPN or total parental nutrition would include, but is not limited to neonatal venous nutrition, peripheral parental nutrition, hyperalimentation, starter TPN, or any other supplementation that would include amino acids that might go by a different name at your facility. If an infant is receiving fluids only and no other feeding method that's listed here on this form, please mark none of the above. Now going over to the left-hand side is the current weight. This is the same as on this collection form now, so please record the infant's weight in grams at time of collection. It's very important not to leave this field blank. It is used to calculate test results. And then going over now, it's the transfusion boxes. And again, like weight, this must be filled out. So please mark yes or no as it's used for result interpretation. A transfusion refers to blood products given before the newborn screen is collected. If there's multiple transfusions, you only need to record information regarding the most recent transfusion. So if there's been 3 transfusions, you would mark yes and then go ahead and write the date of the last transfusion, again following that 8-digit format for the date. Transfusions include all blood products, including but not limited to red blood cells, plasma, intravenous immunoglobulins, and platelets. However, albumin does not affect newborn screening results. Also, if a baby has received a transfusion before delivery or an intrauterine transfusion, please mark yes and the date that occurred as well. Then, continuing on the form, the NICU box has moved on the form, and we've added another box for meconium ileus. If a patient's in the NICU, PICU, or another high acuity level care at the time of the newborn screening collection, please mark this box. If they're not, just go ahead and leave that blank. Meconium ileus, that is a bowel obstruction that occurs when the meconium in the infant's intestine is even thicker and stickier than normal meconium, and it can create a blockage then in the small part of the intestine. This can interfere with cystic fibrosis analysis, and so we're requesting this information. So please check the box only if the infant has or is suspected to have meconium ileus. If no meconium ileus is suspected, leave blank. Meconium ileus is known to interfere, like I said, with the screening for cystic fibrosis, and so the algorithm for the testing will be changed based on this information, so it's important to provide this if known. We're going to jump now to the bottom of the form, and there's been some changes here. The State Hygienic Lab is going to move, hopefully this year, into a new data system or a lab information management system. And so with that, the facility IDs are all going to change. And so with that being said, instead of having everyone learn a new facility ID, we've actually just removed that portion from the form and decided that we would provide everyone pre-printed labels with their facility name and address when you order your collection forms. So when you order your collection forms, we will create the same amount of labels that we'll send with you, and you can apply them to the forms. Please check that the name and address and city and state are accurate before you apply them to the form. So you'll just apply the pre-printed label to the top ply of the form. You don't need to do it for all plies, just the top. That's the one that we'll use to do the data entry. Do not share your forms or labels with other facilities, as this can lead to results being sent to wrong organizations. The submitted information provided is used for result reporting purposes as well as billing. So please provide accurate and complete information. If by chance you're in a situation and you don't have a label, the fields are still there, and you can write out your facility's name and complete address. We do ask that you write your full name and avoid using abbreviations, and write your full street address. It's very important now that so many institutions have the same name or are part of a larger affiliation, such as a Stanford, so we know exactly which Stanford is submitting, and we can make sure to bill and get the report to the right person. If your organization requires clinic or satellite location samples to be processed through a main lab, please make sure to write down the main lab information or wherever you want the report and bill to go to, so we can get that to the appropriate section. And then we'll still have the barcode stickers that will be used to place on the birth certificate worksheet. So one half of the sticker still will be there, and you can, on the submitter's copy of the newborn screening form, and then the second half will be placed on the birth certificate worksheet to help ensure that the correct barcode number is entered with, to help with the birth matching process. Again, this is important to have a process in place to place the unique identifier number from the collection card onto that certifier's worksheet for completing the birth certificate. This will help allow the correct matching of the infant's initial newborn screening lab to their birth record. And then next I'm going to pass it over to Emily.
Yes, hi. I'm going to talk about the Guardian section of the new collection card. For the South Dakota Newborn Screening Collection Card, the birth mother information is vital for matching newborn screen results to the correct birth certificate. Birth mother information will almost always be entered in the Guardian section of the collection card. So almost all situations, we ask that you check the mother box and the Guardian checkbox and complete the birth mother's contact information in the following fields. Only for special circumstances of guardianship, such as adoption or surrogacy, would we want anyone other than the birth mother listed in this section of the card. So only in these special circumstances would you check other in the Guardian checkbox and specify the guardian's relationship to the infant. So after you complete the Guardian checkbox, we ask that you fill out the birth mother or guardian's last name, followed by his or her first name. In the next row, please complete the birth mother or guardian's birth and gender. We also ask for the birth mother or the guardian's phone number, including a 3-digit area code. Please make sure that the number listed here will be answered on weekends and holidays. In the event of a time-critical newborn screen result, accurate contact information for birth mother or guardian is critical in order to reach the family and make sure the infant gets the appropriate care he or she needs. On the last row of the Guardian section, it asks for birth mother's maiden name. This is another required data field necessary to match newborn screen results to the birth certificate. No matter what the guardian status is, always record the birth mother's maiden name in this last field. And the next section of the card is the healthcare provider information, and you'll notice that we now have 2 sections for healthcare providers. The initial section is for the ordering healthcare provider. Complete the last name followed by the physician's first name, as well as a phone number, including an area code for the physician who ordered the newborn screen. The next row, we ask for facility of birth. This is a required data element for matching newborn screen results to birth certificate information. Please verify that you're entering the correct birth facility in this field and do not assume that the birth facility is the same as the submitting facility. If the infant was born outside of South Dakota birth facility, for example, a home birth or an out-of-state birth, please enter home birth and or the abbreviation of the state the infant was born in. For example, Minnesota, you could put MN, Iowa, you could put IA, etc. The third row of the healthcare provider section, thank you, is for the primary care provider, or the provider that will be caring for the infant after the baby is discharged from the birth hospital. If the primary care provider is the same as the ordering healthcare provider, all you need to do is check the checkbox and indicate same as above. If the primary care provider is different than the ordering provider, please list the name of the primary healthcare provider or the clinic with the last name followed by first name, and also include a phone number with area code. In the event of a time-critical newborn screen result, accurate contact information for the primary health care provider is vital to ensure timely medical intervention. And last, we have our contact information. For the Iowa State Hygienic Laboratory, they can be reached at area code 515-725-1630 for any questions regarding data entry or corrections, or to order dried blood spot forms and envelopes. You can also contact Lucy Fossen at the South Dakota Newborn Screening Program, and her number is 605-773-3361, and there is also a website with some additional resources that you can check out as well. And don't hesitate to contact the South Dakota Newborn Screening Program or the State Hygienic Laboratory for any questions with unusual situations or any concerns about the new forms that you may have. And last, we would like to open it up for questions. If anybody has any questions, feel free to unmute yourself. And you can do that on the bottom left-hand corner of your computer screen, or if you've joined via phone, I believe it's *6. Is that correct, Ashley?
Yes.
To unmute, and we will take any questions you have.
There's also a chat box feature that we can read those. It doesn't look like we have anything in there now, but quiet group. Lucy, did you have anything that you wanted to add at all?
I have a question, and I apologize if you've already answered this, but what goes in the barcode box?
Barcode box. Let me get back to the, whoops. Let's see. And these boxes down here?
I actually don't have the screen, I'm only on the phone.
Okay.
But in the form itself, over on the right-hand side, there's a big box that says barcode.
On the right-hand side?
Yep.
So there shouldn't be anything, I'm sorry, go ahead.
It's above where it says place a session label within this box. And there's an up and down rectangle along the right-hand side of the form.
So if you're looking at, there's a barcode on the second ply of the form. There's peelable stickers. So one of them is meant to stay on there. There's nothing you need to fill out there. It's half of the stickers needs to be put on the birth certificate worksheet for on their birth certificate so that they can positively link that this patient has had a newborn screening done.
Okay, so the sheet I'm looking at must be the second ply of it.
Yes, I would assume so, yeah. Yeah, yep.
Okay,
yes.
thank you.
No problem. Thanks for the question. I think there's a question that was put in the chat box. It says, how important is it to receive the PKU shortly after collection? So for the newborn screening, is now testing for over 50 different disorders. So that is something we're also trying to educate to try to change the language of not calling it the PKU. It causes some confusion sometimes for parents when they get a call that they had an abnormal PKU, but it actually was a different newborn screening test. And it's very important after it's collected to get that sent into the lab to be tested. There are some of the disorders that we screen for that can be life-threatening in a matter of hours. And so the sooner that we're able to get it tested and if in fact they do have something elevated, get confirmatory and have them clinically assessed, the better. So we'd ask as best as you can to collect them when they're eligible or after 24 hours and get them on the courier at the soonest pickup and sent to the lab. Are there any other questions? I don't want to keep everyone. We appreciate your time today and your busy schedules to join us today. Again, there will be a recording of this and we can make the slides available as well for future reference, and I will email out that information once the recording's available and where you can find that posted at, as well as a copy of the slides. Well, I think we'll do one more call for questions, and if there's not that, then we'll conclude this and let everyone get back to their day. Kim Piper, you can go ahead and stop recording. And again, thanks everyone. Have a good day. And